What if I told you that the very medical tests you are scheduling right now to save your life might actually be the exact things that ruin it? Today, I am pulling back the curtain on a dirty little secret of modern medicine. It is a secret that generates billions of dollars a year, but leaves patients overmedicated, overwhelmed, and completely stripped of their quality of life. If you are over 50 years old, your risk of falling victim to what we in the industry call the medical cascade is at an all-time high. You go in feeling perfectly fine, you get a test just to be safe, and suddenly you are on an operating table for a condition that was never going to kill you. My name is Dr. Sarah Carter, and after decades of clinical practice, I have seen the devastating consequences of overtesting. Today, I am going to reveal the 5 medical checkups I would absolutely never get after the age of 50, and the critical tests you should be demanding instead. If you are ready for the unapologetic truth about your health and want to navigate the medical system without becoming its next victim, hit that subscribe button right now because we are diving deep. Imagine you have a vintage sports car. It runs beautifully, the engine purrs, and it has never let you down. Now, imagine taking that perfectly running car to a mechanic every single month and demanding they take the engine completely apart, down to the last screw, just to check if anything might possibly go wrong in the future. What do you think happens? Every time they take it apart and put it back together, they scratch a valve, they loosen a belt, they introduce a problem that was not there to begin with. Soon enough, your beautiful vintage car spends more time in the shop than on the road. This is exactly what we are doing to our bodies after 50. We treat them not as masterpieces of biology, but as ticking time bombs waiting to be diffused. And the detonator is often an unnecessary medical test. Let us start with checkup number 1, the routine annual full-body MRI scan. You have probably seen the aggressive marketing for these. Private clinics charging thousands of dollars, promising peace of mind by scanning you from head to toe to catch cancer early. It sounds like the ultimate proactive health move, right? Wrong. Getting a full-body scan when you have absolutely zero symptoms is one of the most dangerous things you can do. Why? Because of something we call incidentalomas. Our bodies are not perfectly sculpted pieces of marble. As we age, we develop little cysts, benign nodules, asymmetrical tissues, and harmless spots on our liver, kidneys, and thyroid. If you live long enough, you will have them. They are completely normal parts of the aging process, like wrinkles on the inside. But when a highly sensitive MRI detects a shadow on your kidney, the radiologist cannot just ignore it. They have to report it. Suddenly, your peace of mind is shattered. You are thrown into a state of sheer panic. What follows is the medical cascade. You get referred to a specialist. The specialist orders a targeted CT scan, which exposes you to massive doses of radiation. The CT scan is inconclusive, so they order a biopsy. They stick a long needle into your kidney, risking severe bleeding and hospital-acquired infections, only to tell you 3 agonizing weeks later that it was just a benign water cyst. You spent thousands of dollars, suffered immense psychological trauma, and risked severe physical complications to find out you were perfectly healthy all along. I will never subject myself to a blind full-body scan. If I have a specific symptom, I will scan that specific area, period. Which brings us to checkup number 2, routine EKG and stress tests for asymptomatic individuals. If you do not have chest pain, shortness of breath, or a strong family history of early heart disease, getting a routine treadmill stress test just because you turned 50 is a recipe for disaster. The heart is dynamic. An EKG is a snapshot of electrical activity that can be influenced by how much coffee you drank that morning, how much you slept, or even just the stress of being in the doctor's office. False positives in routine stress tests are astronomically high. If your EKG shows a slight, clinically insignificant anomaly, the doctor has to act defensively. They will send you for an angiogram. This is not a harmless procedure. They thread a catheter through your groin or your wrist all the way into your heart, injecting radioactive dye. It carries a real risk of tearing a blood vessel, causing a heart attack, or triggering a stroke. And very often, what do they find? A tiny, stable plaque buildup that is completely normal for a 55-year-old and would never have caused a heart attack. But because they are already in there, they might place a stent. Now you are on potent blood thinners for the rest of your life, bruising easily and constantly worrying, all because of a routine test you never needed. Unless you have symptoms, focus on your metabolic health, your blood pressure, your blood sugar, and your daily movement, rather than going hunting for shadows on an EKG. Now, checkup number 3. This one is going to make a lot of people angry, but it must be said. Routine PSA testing for prostate cancer in men over 70, and sometimes even younger, depending on risk factors. The PSA, or prostate-specific antigen test, is a simple blood test. But here is the massive flaw. PSA levels can spike from something as simple as riding a bicycle, having an enlarged prostate, or a mild urinary tract infection. It is highly nonspecific. Prostate cancer is very real, but the vast majority of prostate cancers grow so incredibly slowly that if you are over 65, you are far more likely to die with prostate cancer than from prostate cancer. But if your PSA comes back slightly elevated, what happens next? The biopsy. Prostate biopsies are painful and carry a massive risk of severe infection. If they find a slow-growing cancer that would never have bothered you in your natural lifespan, you are suddenly labeled a cancer patient. The fear takes over. Men rush into aggressive surgeries or radiation. The result? A staggering percentage of these men end up with permanent urinary incontinence and erectile dysfunction. Their quality of life is destroyed to cure a cancer that was essentially asleep. The evidence-based approach is shifting toward watchful waiting and active surveillance. I am not saying never get tested, but blindly doing a PSA test every single year without a deep conversation about the brutal consequences of overtreatment is a dangerous game. Let us move to number 4, annual DEXA scans for bone density. As women enter menopause, the sudden drop in estrogen naturally causes a decrease in bone density. This is a physiological fact. A DEXA scan measures this. But here is the problem. Bone remodels extremely slowly. Getting a DEXA scan every single year is like staring at the hour hand of a clock and waiting for it to move. You will just drive yourself crazy. The real danger here is the aggressive overprescription of bisphosphonate drugs based on a single, slightly low DEXA score. These drugs do build bone mass, but they make the bone brittle. They stop the natural turnover of bone cells. If you take them unnecessarily or for too long, you face horrific side effects, like spontaneous fractures of the femur, your thigh bone literally snapping while you are just walking, or something called osteonecrosis of the jaw, where the bone in your mouth begins to die and decay. It is terrifying. Instead of obsessing over an annual scan, we should be focusing on the actual foundations of bone health. Heavy resistance training, adequate vitamin D3 combined with K2, and optimizing protein intake. I would never get a DEXA scan more frequently than every 5 to 10 years, unless I had a specific, severe risk factor. And finally, checkup number 5. The expensive, extensive, functional medicine food sensitivity panels. Specifically, the IgG panels. If you have been feeling fatigued or bloated, you have likely been targeted by ads for these mail-in tests. You send in your blood, and they send you back a terrifying chart showing you are allergic to 50 different foods, including broccoli, almonds, and chicken. Here is the scientific reality. The presence of IgG antibodies to a specific food does not mean you are allergic to it. It actually means the exact opposite. It means your immune system has recognized the food and developed a tolerance to it. It simply tells you what you have been eating recently. But when patients see these red flags on their charts, they panic. They start eliminating dozens of highly nutritious foods from their diet. I have seen vibrant, healthy seniors develop severe malnutrition, chronic anxiety, and legitimate eating disorders because they are terrified of a piece of spinach, all based on a test that is scientifically invalid for diagnosing allergies. If you suspect a food is bothering you, do a simple elimination diet for 3 weeks and see how you feel. Do not let a $300 scam test dictate your life. Let me tell you about a patient of mine. I will call her Margaret. Margaret was 58, full of life, hiking every weekend. Her daughter bought her a full-body MRI package for her birthday. The scan found a tiny nodule on her lung. The radiologist flagged it. Margaret went from being a vibrant hiker to an anxious wreck overnight. She was pushed into a lung biopsy. During the procedure, her lung collapsed, a known complication. She ended up in the ICU, developed pneumonia, and spent a month in the hospital. The biopsy results finally came back. It was scar tissue from a childhood chest cold. It was nothing. Margaret lost a year of her life to anxiety and recovery, all because we went looking for trouble where there was none. So, what should you do instead? How do you actually protect your health without falling into this trap? Here are my 3 non-negotiable action steps for anyone over 50. First, master your metabolic panel. Forget the exotic tests. Focus relentlessly on your fasting insulin, your hemoglobin A1C, and your ApoB levels. These 3 markers will tell you more about your risk for heart disease and dementia than almost anything else. If you optimize these, you are winning the game. Second, adopt the wait-and-see protocol for non-urgent symptoms. If you have a mild ache, a random twinge, or a minor digestive issue that does not involve red flag symptoms like sudden weight loss or severe bleeding, give your body 2 weeks. The human body is an incredible self-healing machine. Most minor anomalies resolve themselves if you just get out of the way. Stop rushing to the specialist for every single hiccup. Third, demand a risk-benefit conversation. Before you agree to any screening test, look your doctor in the eye and ask, what is the false positive rate of this test? And if we find something borderline, what is the next step? If the next step is highly invasive and you do not have severe symptoms, you have the right to decline. You are the CEO of your own body. Navigating healthcare after 50 requires courage. It requires the confidence to say no to fear-based marketing and yes to foundational health habits. Your body is not a liability. Treat it with respect, nourish it, move it, and stop constantly searching for reasons why it might be broken. If this video opened your eyes and gave you your power back, please hit the like button and make sure you subscribe to the channel. It helps us spread this message and protect others from the medical cascade. Stay strong, stay informed, and I will see you in the next video.